There is a simple truth that most men are never told until it becomes a problem, and by then, the body is already struggling to compensate. After the age of 60, one of the most overlooked changes in male physiology is the gradual loss of natural lubrication and skin hydration in sensitive tissues. This is not random. It is a direct result of hormonal shifts, reduced collagen production, decreased sebaceous gland activity, and slower cellular regeneration. Scientific dermatology research shows that aging skin loses up to 50% of its natural moisture-retaining ability over time, making friction far more damaging than it ever was in youth. And yet, many men continue to ignore this change completely. They assume the body will respond the same way it always has. But inside the tissues, something very different is happening. The protective barrier that once allowed smooth, friction-free movement becomes thinner, drier, and more vulnerable to irritation. This means that what once felt normal can now silently create inflammation at a microscopic level. Here is what makes this so dangerous. Friction injury does not announce itself immediately. It builds slowly. At first, it may feel like nothing more than mild sensitivity or temporary discomfort. But repeated dry friction creates microabrasions in delicate tissue layers. These are tiny invisible disruptions in the skin that trigger localized inflammation. And inflammation, as medical science repeatedly confirms, is one of the key drivers of tissue aging and dysfunction. Urology and dermatology studies consistently show that hydrated, well-lubricated tissue has significantly lower risk of mechanical injury. This is because moisture reduces shear force, the internal stress that occurs when layers of skin move against each other without protection. Without that protective layer, the force is transferred directly into the tissue structure itself. Over time, this can lead to irritation, reduced sensitivity, and in some cases, chronic discomfort that affects sexual well-being. What makes this even more important after 60 is the change in blood flow dynamics. Circulation naturally slows with age due to increased arterial stiffness and reduced nitric oxide production. Nitric oxide is the molecule responsible for vasodilation, the widening of blood vessels. When its levels decline, tissue oxygenation decreases slightly, which means healing also slows down. So even minor friction injuries take longer to repair, allowing inflammation to persist longer than it should. This is why lubrication is not a luxury. It is a physiological necessity. Medical experts in sexual health emphasize that lubrication dramatically reduces mechanical stress on aging tissue. Water-based lubricants, in particular, mimic the body's natural moisture balance without disrupting pH or causing irritation. They act as a protective buffer, allowing movement without damaging the skin's fragile outer layer. In clinical studies on sexual function in older adults, the use of lubrication has been associated with reduced discomfort, improved satisfaction, and lower incidence of tissue irritation. But there is another hidden benefit that is rarely discussed. Lubrication does not just protect the surface. It indirectly supports blood flow efficiency. When friction is reduced, the body does not activate protective stress responses. That means the sympathetic nervous system remains calmer. And when the body is in a calmer state, blood vessels remain more open, circulation improves, and oxygen delivery to tissues becomes more efficient. In contrast, dry friction activates microstress responses in the body. The nervous system interprets irritation as potential injury. This triggers the release of stress hormones like cortisol and adrenaline. These hormones constrict blood vessels, reduce circulation, and can even interfere with natural arousal responses. So what begins as a simple mechanical issue can quickly become a full-body physiological response. And here is something most people never consider. Repeated irritation in delicate tissue can lead to nerve desensitization over time. Nerves exposed to chronic mechanical stress may reduce their responsiveness as a protective adaptation. This means sensation can gradually diminish, not because of aging alone, but because of repeated physical strain without proper protection. Hydration and lubrication break this cycle. When tissue remains protected, nerve endings maintain their natural sensitivity, blood vessels remain flexible, inflammation is minimized, and the entire system functions more smoothly and efficiently even in later years. There's also a deeper biological principle at work here. The body is constantly trying to maintain homeostasis, a stable internal environment, but aging challenges this balance. Every system becomes slightly less efficient at regulating moisture, repairing microdamage, and controlling inflammation. This is why external support, like proper lubrication, becomes increasingly important with age. It is not about enhancement, it is about restoration of balance. Think of the skin like a protective ecosystem. When moisture is present, the ecosystem thrives, cells communicate properly, blood flow is stable, tissue remains flexible. But when moisture is absent, the ecosystem becomes stressed. Barriers weaken, irritation spreads more easily, and recovery slows down significantly. This is also why urologists often emphasize a holistic approach to sexual health in older men. It is not just about function, it is about preservation. Every small decision, hydration, lubrication, circulation, rest, contributes to whether tissues remain healthy or gradually deteriorate under repeated stress. And perhaps the most important realization of all is this: discomfort is not something to ignore or normalize. It is information. It is the body signaling that conditions are not optimal for safe function. Ignoring that signal does not make it disappear. It allows damage to accumulate silently over time. But when that signal is respected, when lubrication is used consistently, when friction is reduced and tissues are protected, the body responds in an extraordinary way. It heals more efficiently. It maintains sensitivity longer. It preserves function deeper into aging than most people expect. Because the truth is simple but powerful. Aging does not automatically mean decline in comfort or function. Much of what people assume is just aging is actually the result of preventable stress on biological tissues. And one of the simplest, most effective protections available is something many overlook entirely: the consistent use of lubrication to support the natural design of the body rather than working against it. Hello everyone, Dr. Alan Mandell here. Welcome back to my channel, Science of Healing. Let me share something very important with you today. Something many men over the age of 60 are thinking about but rarely talk about openly. Sexual health does not disappear with age. In fact, maintaining healthy sexual function, including masturbation, can play a powerful role in protecting your prostate, improving blood flow, supporting hormone balance, and even boosting your mood and sleep quality. Science has shown that regular ejaculation is associated with a lower risk of prostate problems, including symptoms related to benign prostatic hyperplasia, and may help maintain healthy pelvic circulation as we age. But here's the key: it must be done safely, gently, and intelligently. Because after 60, your body changes. Your tissues are more delicate. Your circulation may be slower, and your nerves can be more sensitive. That means certain habits that were harmless in your 30s or 40s can now lead to pain, inflammation, erectile difficulties, or even urinary problems if you're not careful. One of the biggest benefits of healthy sexual stimulation after 60 is improved blood flow. Erections are all about circulation. When blood flows into the penile tissues, it delivers oxygen and nutrients that keep those tissues healthy and responsive. Without regular stimulation, those tissues can lose elasticity over time. That's why urologists often say, use it or lose it. Regular, gentle sexual activity, including masturbation, can help preserve erectile function, support prostate drainage, and maintain pelvic muscle tone. But there's a right way and a wrong way to do it. Most men never hear this truth, not from their doctor, not from their friends, and certainly not from society. But after the age of 60, your body is no longer the same machine it was at 30 or 40, and the way you treat it during sexual activity can either preserve your health or quietly accelerate damage you don't even feel happening in the moment. Inside your body, something profound is changing with every passing year. Scientific research in vascular medicine shows that blood vessels gradually lose elasticity with age due to reduced collagen production and increased oxidative stress. This means circulation becomes more fragile, more restricted, and more sensitive to physical pressure than ever before. And yet, many men unknowingly continue the same aggressive habits they once used in youth, not realizing that what once felt harmless can now create microscopic injuries at a tissue level. When excessive force or speed is applied during sexual stimulation, tiny structures in the skin and underlying vascular tissue can experience what researchers call microtrauma. These are not immediate, visible injuries. You don't see them in the mirror. You don't feel them right away, but they accumulate quietly. Over time, these microtears can contribute to inflammation, reduced sensitivity, and even mild scarring that interferes with natural blood flow dynamics. And when blood flow is compromised, erectile strength naturally declines. Urology studies have consistently shown that penile tissue health is directly dependent on oxygen-rich blood circulation. That circulation is not just about function, it is about maintenance. Just like a muscle that weakens without exercise, penile tissues require regular, gentle blood flow to maintain elasticity and responsiveness. But here is where the mistake begins. Many men equate intensity with effectiveness. They believe faster or harder stimulation leads to better outcomes. In reality, after 60, the opposite is often true. The nervous system also undergoes changes with age. Nerve conduction velocity slows down, meaning signals between the brain and genital tissue take longer to travel and respond. If stimulation is too aggressive, the nervous system can actually become overstimulated, leading to reduced sensitivity over time. This is why some older men report needing more stimulation to achieve the same response they once had naturally. It is not simply aging. It is often the result of repeated mechanical overstimulation. And here is something even more concerning. Chronic overstimulation without proper recovery can activate low-grade inflammatory pathways in the pelvic region. Inflammation is one of the most destructive forces in aging biology. It quietly damages tissues, stiffens blood vessels, and reduces overall organ efficiency. What starts as a simple habit can slowly contribute to long-term functional decline if the body is not given time to recover and repair. But there is a powerful truth hidden in all of this. The human body is not fragile by accident. It is adaptive. Research in regenerative medicine shows that tissues respond positively to gentle, consistent stimulation. In fact, controlled, low-intensity physical stimulation improves endothelial function, which is the health of the inner lining of blood vessels. Better endothelial function means better circulation, stronger oxygen delivery, and improved tissue resilience. This is where the concept of gentle stimulation becomes medically significant, not just a lifestyle suggestion. When movement is slow and controlled, the parasympathetic nervous system, the healing and repair system of the body, becomes activated. Heart rate stabilizes, blood vessels dilate more efficiently, oxygen delivery improves. And most importantly, tissue stress is reduced, allowing the body to maintain long-term structural integrity. Think of it like this. If you bend a plastic tube aggressively and repeatedly, it weakens and eventually cracks. But if you flex it gently within its natural range, it remains functional for far longer. Your vascular and nervous systems behave in a very similar way. They are not designed for constant mechanical stress. They are designed for rhythmic, balanced stimulation. followed by recovery. Medical imaging studies have even shown that consistent low-pressure blood flow stimulation supports the maintenance of smooth muscle tone in erectile tissue. Smooth muscle is what allows expansion and contraction during arousal. When it becomes stiff or damaged, erectile quality declines. But when it is maintained through gentle circulation, it retains its responsiveness even in older age. There is also a psychological layer that cannot be ignored. Excessive intensity often activates sympathetic dominance, the stress response system. This floods the body with cortisol and adrenaline, hormones that constrict blood vessels and reduce sexual performance. On the other hand, gentle, mindful stimulation activates relaxation pathways that improve blood flow and enhance sensory awareness. In simple terms, your nervous system determines your physical response far more than most people realize. And perhaps the most overlooked fact of all, recovery is where healing actually happens. During rest, the body repairs microscopic tissue stress, restores nitric oxide balance, and rebuilds vascular flexibility. Without recovery, even normal activity can slowly accumulate strain. This is why aging bodies require a different rhythm, not less function, but smarter function. So when we talk about sexual health after 60, we are not talking about limitation. We are talking about adaptation. We are talking about respecting biological changes that are measurable, documented, and predictable. The goal is not to stop. The goal is to sustain. Because the truth is simple but powerful. Your body does not decline randomly. It responds to how it is used. And when you shift from force to awareness, from intensity to control, from speed to circulation, you are not losing function. There is something most men only discover when their bodies start sending signals they can no longer ignore. And by that time, the root cause is often not obvious at all. Sexual health after 60 is not determined by one single factor. It is not just hormones. It is not just age. It is not just activity. It is a complex interaction between circulation, recovery, nutrition, nervous system health, inflammation control, and cellular repair. And scientific research consistently shows that when even one of these systems begins to decline, sexual function is often one of the first areas where the effects become noticeable. But here's what is truly shocking. Many of these changes are not permanent. They are functional. That means they can be improved, supported, and in many cases, partially reversed through daily habits. The body at 60 is not broken. It is simply operating under different biological conditions that require different inputs. Let's begin with circulation because everything in male sexual function depends on blood flow. Medical research in cardiovascular physiology has shown that nitric oxide production declines with age. Nitric oxide is the molecule that signals blood vessels to relax and expand. When it decreases, arteries become slightly stiffer and blood flow becomes less efficient. This is not only a heart issue, it directly affects erectile quality, sensitivity, and recovery time. This is where nutrition becomes one of the most powerful tools available to the aging body. Beetroot, for example, is not just a vegetable. It is a natural source of dietary nitrates, which the body converts into nitric oxide. Multiple clinical studies in vascular medicine have shown that nitrate-rich foods can significantly improve endothelial function, the health of the inner lining of blood vessels. When endothelial function improves, circulation improves. And when circulation improves, oxygen delivery to sexual tissues becomes more efficient, supporting stronger and more sustainable function, but circulation alone is not enough. The body also needs structural stability at the level of blood vessels. This is where healthy fats become critical. Walnuts are one of the most researched plant-based sources of omega-3 fatty acids. Omega-3s reduce systemic inflammation, improve arterial flexibility, and support healthy lipid profiles. Inflammation, when left unchecked, is one of the most destructive forces in aging physiology. It quietly damages blood vessels, reduces hormone sensitivity, and slows tissue repair. By reducing inflammation, Walnuts indirectly support both cardiovascular and sexual health at the same time. And then there is zinc, a mineral that becomes increasingly important with age. Pumpkin seeds are one of the richest natural sources of zinc. Zinc is essential for testosterone synthesis, immune function, and cellular repair. Research in endocrinology shows that even mild zinc deficiency can negatively impact testosterone levels and sexual function in men. And unfortunately, zinc deficiency becomes more common with age due to reduced dietary absorption and changes in digestion. This is why simple foods like pumpkin seeds can have a surprisingly powerful effect on hormonal balance and vitality. But nutrition alone does not complete the picture. There is another system that often gets overlooked, and yet it is one of the most critical for long-term sexual health: recovery. As the body ages, cellular repair processes slow down. This includes muscle recovery, nerve regeneration, and vascular repair. During deep rest, the body activates what scientists call anabolic repair pathways. These pathways are responsible for rebuilding tissue, restoring energy balance, and maintaining hormonal equilibrium. Without sufficient recovery, these systems become overworked and less efficient over time. This is why sleep becomes biologically non-negotiable after 60. Research from endocrinology and sleep medicine shows that the majority of daily testosterone release occurs during deep sleep cycles. When sleep is disrupted or shortened, testosterone production declines. This does not just affect libido, it affects energy levels, mood stability, muscle maintenance, and even cardiovascular health. Poor sleep is not just fatigue. It is a systemic hormonal disruptor, and yet many men underestimate its importance. Then there is another critical layer: pelvic floor function. The pelvic floor is a group of muscles that support bladder control, core stability, and sexual function. With age, these muscles naturally weaken due to reduced activity and neuromuscular signaling efficiency. But research in physical therapy and urology shows that targeted pelvic floor exercises can significantly improve erectile strength, urinary control, and overall pelvic stability. These muscles respond to training just like any other muscle in the body. They are not lost with age. They are lost with inactivity. Even simple contraction exercises done consistently can improve blood retention during arousal and support stronger physical response. This is not theory. It is well documented in rehabilitation medicine. But there is still another invisible factor that plays a massive role in sexual health after 60: stress physiology. When the body is under chronic stress, it shifts into a sympathetic state, often called fight or flight. In this state, blood vessels constrict, digestion slows, and reproductive function is deprioritized. This is a survival mechanism. The body does not prioritize reproduction when it believes it is under threat. That means chronic stress directly suppresses sexual function at a biological level. Elevated cortisol levels have been shown in research to interfere with testosterone production and reduce nitric oxide availability. This creates a double impact: reduced desire and reduced physical performance. And the challenge is that stress does not always feel dramatic. It can be subtle, constant, and unnoticed, yet still biologically active every day. This is why recovery is not just physical, it is neurological. Relaxation practices, gentle movement, and consistent daily rhythm help shift the body back into parasympathetic dominance, the state where healing, repair, and circulation improve. In this state, blood vessels dilate more easily, hormone balance stabilizes, and sexual responsiveness naturally improves. When all of these systems are viewed together, circulation, nutrition, sleep, pelvic strength, and stress regulation, a clear picture emerges. Sexual health after 60 is not controlled by one factor. It is the result of multiple interconnected systems, either working in harmony or slowly drifting out of balance. And here is the most important truth of all: The body at 60 is still capable of adaptation. It still responds to nutrients. It still responds to movement. It still responds to rest. It still responds to care. It is not defined by decline. It is defined by input. Every meal, every night of sleep, every moment of movement, and every reduction in stress becomes a signal to the body about how to function. And when those signals are consistent, supportive, and biologically aligned, the body does something remarkable. It does not just survive aging.